Hello, and welcome to my presentation today talking about the art of rhinoplasty. Rhinoplasty refers to the surgical procedure that's performed to reshape the internal and external nasal structures. But we must remember before we start talking about the surgery of rhinoplasty that noses come in a wide range of shapes and sizes, and I thought this was interestingly portrayed in this artist's rendition that I saw on the internet. Understanding how to analyze the facial structures is a very important point in planning and also performing a successful rhinoplasty. When we're looking at the front view of the face, as we are here on this slide on the left, ideally the nose and the eye widths are equal, and each of them should be approximately 1/5 of the total facial width. When we look at the profile, as shown as the picture on the right, the facial profile is divided into thirds, with the top third going from the hairline down to the top of the nose, the middle third consisting of the nose, which is from the top of the nose to the bottom of the nose, and then the bottom third of the face is from the bottom of the nose down to the chin. There are also several angles on a facial profile that we use to analyze balance and proportion between the nose and the rest of the face. This diagram here on this slide shows you several of the angles that we will analyze in our planning before rhinoplasty surgery. Every rhinoplasty surgeon knows that the anatomy of the nose is very complex. The internal and external nose is composed of bone and cartilage. If you look at this drawing on the left, you'll see that the upper third of the nose is made of bone. The middle third and the lower third are made from a pair of cartilages called the upper lateral cartilages and the lower lateral cartilages. You also notice that the nostrils or the rims of the nostrils are not really composed of cartilage but maybe fibrofatty tissue. On the right, you see that the septum is what divides the left from the right side of the nose. The septum is also, just like the outside of the nose, composed of bone in the back and cartilage toward the front. You also see in this drawing turbinates. Now, turbinates are bony shelves that are covered in nasal mucosa, and the purpose of them is to increase the surface area of the inside of the nose so you can humidify and filter the air that you breathe. Our noses reach full growth and maturity between the ages of 17 and 19 for women and slightly later for men. This is important to understand because our nose does not grow anymore after our early 20s. What happens to our nose is that it changes due to the aging process, and this is very well documented on this photo on the left. You can see a daughter age 26 and the mother age 64. So what happens to the nose as it ages? Well, the skin thins. We lose soft tissue volume around the nose, so it changes how it sits in relation to the cheek and the lip. If you look at the diagram on the right, the upper lateral cartilages can weaken and they can collapse in, much like the sides of a tent can collapse in. And then the lower lateral cartilages can also weaken, but they can also droop downward toward the upper lip. So your nose is not growing, but it is drooping. Computer imaging is a fantastic tool that I actually will use during the consultation, and then we also use it for the surgical planning and the preoperative visit. But this is an example from a colleague of mine who published a paper in 2004 where he took one patient and he used the computer imaging to alter different aspects of the nose. And this is very similar to what we can do when I'm doing a consultation or a preoperative visit with a patient. So if you look at that top aspect, it's changing the position of the nasal bridge from a very scooped out bridge on the left to a very over-projected bridge on the right. That middle set of pictures is all it's doing is rotating the tip from an over-rotated tip on the left to an under-rotated droopy tip on the right. And the very last row is changing the way the tip projects from the face, from a normal projection on the left to an over-projected middle third of the face due to the nose being over-projected. There's several reasons why someone comes to see me to talk about doing a septorhinoplasty. One reason is for nasal obstruction or breathing issues. Now, this can be due to a previous trauma that maybe also altered their appearance, but it could also be due to the aging process of the nose where there's weakening of the cartilages and they're having some difficulty breathing. But it could also be no history of trauma, no history of breathing issues, but they're just really unhappy with the shape, the size, or projection of the nose. These are some of the main reasons why people come to me requesting a change in their nasal appearance. It could be that they feel like their nose is crooked, they'd like to have it straighter. It could be that they feel like their nose is too large and they'd like to have it better fit their face. Getting rid of a bump on their bridge is very common. People feel like they have a very wide or bulbous tip, or it could be a droopy tip. And then also there could just be some tip asymmetries between the left and the right side that they like to have softened. So these anatomical slides are here just as a reminder that the anatomy of the nose is very complex, and that is also the very central focus of your face. So I just want to emphasize that I approach a rhinoplasty from an aesthetic as well as a functional approach. The goal is for your nose to blend with the rest of your face, for it to look natural, to look unoperated upon, but we want to maintain and maybe even also improve your breathing. Septoplasty and rhinoplasty are often performed together, and a typical procedure can take anywhere from 2.5 to 4 hours depending on the complexity of the procedure. There are two approaches that can be used to perform a rhinoplasty. On the left is one approach, is called the closed or internal approach, and that's where all these incisions are made up inside the nostrils, as indicated by the little dots there in the gray area. There's also an open or external approach, and it has the same incisions inside the nose, but we connect those now with a small incision that goes across the columella, or that bridge of skin between the nostrils. I perform most of my rhinoplasty procedures with an open or external approach because in my hands I feel like I can get a better result, particularly when I'm looking at doing some meticulous work done on the nasal tip cartilages. And I just want to show you the scar is very well hidden and people do not mind it. On the left is a before patient who had a septorhinoplasty, and then on the right you can see a much improvement with more of an equilateral triangle shape to the base of the nose and really an imperceptible scar. I'd like to share a few patients just to give you some examples of before and afters, but again I want to emphasize that everybody's nose is very different and very unique to their face, but this just gives you some idea of some of the things that we can accomplish. So on the left is a before picture of an 18-year-old girl. She felt she had a very bulbous or wide tip. She felt that her nose was too long for her face and over projected. And if you look at on the right, here she is 1 year post-op with a better rotated and more narrow tip, and a more pleasing appearance to the nasal bridge as well. I included this before and after of the same 18-year-old because it shows you another angle that we look at. It's called the nasolabial angle, and I emphasized it with the dark line underneath the nose on the left and on the right. So for men, that angle can be close to 90 degrees, which is what it was for her in her before picture. But for a woman, it should be more of a 100 to 110 degree angle. And you can tell that just looks much more feminine look to the tip to have the tip rotated ever so slightly. Also, her nasal length was shortened, and we got rid of the nasal bump that she had. Here she is again on the left and right without the dark line, so you can get a better idea of the nice tip rotation that we're able to achieve by rotating and deprojecting her tip and also her bridge. And this is a nice view looking at the oblique angle of the before and 1 year postoperatively after undergoing a septorhinoplasty. You can really tell in this the improvement with the nasal bridge projection, the nice tip rotation, and the softening and shortening of the nose. Now this is a different situation with a 56-year-old gentleman who really felt like his nasal bridge and his tip were over projected, but if you notice the rotation of the tip is fine, it's a 90-degree angle, so we wanted to maintain his tip rotation but deproject the bridge and the tip. Here he is before and approximately 4 to 5 months post-operatively. Here's an oblique view of the same gentleman showing a nice improvement in the deep projection of his nasal bridge and his tip, maintaining tip rotation, but you can also see we're able to give a nice improvement to the tip asymmetry that he had in his before photograph. So this is a 48-year-old female who came to me with a history significant for trauma to her nose as a teenager. And this trauma resulted in this asymmetry as well as significant obstruction, particularly on the right side. Her septum was very deviated to her right side. But you can see the upper nasal bones are deviated to the left, whereas the tip cartilages are deviated to the right, kind of an S-shaped deformity. And you can see after 3 to 4 months post-operatively, much improvement in straightening of the nasal bridge and tip and much softening of the asymmetrical tip cartilages. I wanted to show this again because I want to show the importance of another form of analysis that we use when we're looking at the nose, and it's called the brow aesthetic line. If you look at the preoperative picture, you can see that the line is not straight. It emphasizes and shows the asymmetry between the left and right side, whereas on the postoperative photograph, this is a much more of an ideal brow aesthetic line. Where the line starts, you can see the brown pencil I put on the nose here. It starts up at the brow, a very parallel, straight, comes down the sides of the nose with just a little bit of a flare at the tip of the nose. So this oblique view shows the nice improvement in the deep projection of her nasal bridge and tip with the mild rotation of her tip, but it also shows the nice improvement in her tip asymmetry and also in the overall appearance of the nose. So on the left is a 40-year-old female with the middle third of her face is overprojected. Remember, when we look at the profile of the face, we look at the top, the middle, and the lower. And so by just doing a septal rhinoplasty and deprojecting her bridge and her tip with a slight rotation, her entire face now is in better balance between the upper, the middle, and the lower thirds of her face. Ideally, a rhinoplasty should be performed once, but this is an example of a patient that had a rhinoplasty performed elsewhere. She did not like the appearance of her tip as a result of that first surgery, and so I performed what's called a revision rhinoplasty, and that's where we went in to improve the appearance of the tip and make it in better balance with the nasal bridge or dorsum. When the surgery is completed, I'll place some tape and a plastic cast on the outside of the nose. I do not use any packing inside the nose. I haven't done that for years. The sutures and the cast are then removed at 1 week, and I will retape the bridge of your nose for a few more days. I do ask my patients to limit their physical activity for the first 2 weeks after surgery, and then the third and the fourth week you can gradually increase back to normal. And truly, the majority of the swelling and bruising decreases in the first few weeks, but nasal skin likes to hang on to swelling, and so if you look in the textbooks, the answer is that you could have persistent mild edema, particularly the tip, for up to a year to year and a half after surgery. So in closing, I just want to emphasize that a septal rhinoplasty is a complex procedure where my goal is to help you achieve your aesthetic goal while maintaining or improving the functionality of your nose. And mainly I want to give you a natural and operated appearance. I really look forward to meeting with you and answering any questions you may have. Thank you very much for listening to this presentation.